Please welcome Cathie Reid.
Thank you, Matthew, for that lovely introduction. And I'm sure my colleagues and the players at the Brisbane Lions will be delighted to hear that they actually made it onto the main stage in Israel, as I mentioned. So what a great day we've had today already. We've heard from so many incredible portfolio companies, all making amazing impacts within their own fields. But as Matthew said, now we're about to hear from a range of startups who are actually making what I think is the ultimate impact that anyone can have. The businesses that they're creating are in the business of saving lives, and that's a truly amazing achievement to be able to have on your resume. My husband Stuart and I have been long-term investors with OurCrowd. I think if we don't hold the title of being the first Australians to be in OurCrowd, we're pretty high up there in the ranks, and we've really enjoyed our association with OurCrowd and the myriad of fantastic companies that we've got to know and introduce over the years. Today I want to introduce a few more of those to you, and with no further ado, our first guest is Alon Zuckerman from Surgical Theatre. Thank you, Alon. Please come up and tell your story.
What surgical theater can do with any type of 2D medical images is turning them into a 3D, 360, volumetric, rich virtual reality format. We call it, in short, 360 XR. The most rewarding part of our work is knowing that our technology made a real difference for patient prognosis, for their surgical outcomes. Meet Itai, a 10-year-old boy who was doing all the sport activities that you can even imagine, as one day he was diagnosed with Ewing sarcoma, an aggressive cancer in his pelvic area. You can see here how in surgical theater we highlighted his tumor in blue, in and all around the ischium bone, a bone that will be removed eventually during surgery. You can see here how Itai, just a week before he was diagnosed, was practicing his ninja exercises, and just a week later, at a hospital, in a wheelchair. Surgical theater empowered the clinical teams and the parents to take really critical decisions for Itai's treatment, to plan for surgery, and to use the technology inside the surgery. These are just a couple of images of Itai during the treatment and the recovery. The day of surgery, as Itai with his mom walking inside the operating room. This surgery will define Itai's ability to ever walk again, to live. Itai, shalom. So nice to have you here. You look great and in amazing shape. Itai, everyone. Itai, what was the #1 activity that you missed the most during those days of treatment?
I missed football and my friends. Also skied, ninja.
That's great. Itai, are your parents here?
Yes, my dad is here. He is you.
And I'm honored to be your dad, Itai. Yes, I am the president of Surgical Theater, but this is not just a job I do. This is saving lives, my sons included. Thank you.
And Itai, and as they make their way off the stage, if you feel the need to dry your eyes after that, please. It's what an incredible moving story, and it's great to know that there's families all around the world who are actually sharing similar stories thanks to the work that Surgical Theatre is doing. Now, every startup is born of an innovative idea that the founder or founders have, but as we've heard so often throughout the day today, for those startups and those innovative ideas to reach their full potential, partnerships are really important, and partnerships are what gives those startups the ability to make that impact and truly be felt on the global stage. This year we saw a really important partnership launched where the WHO Foundation partnered with OurCrowd to launch a $200 million global health fund. I'd now like to welcome Anil Soni, the CEO of the WHO Foundation, which mobilises private capital and partnerships to advance the mission of the World Health Organization, to the stage to tell us more about that fund. Thanks, Anil.
Itai's story is so touching and it's so inspiring, and I am here to ask for your help to ensure that every child in the world has access to quality healthcare, just like Itai. Unfortunately, 2 billion people, more than 1 in 4 people on the planet, don't have access to essential medicines, and as a result, millions of children, 5 million children, die every year from health conditions that can be prevented and treated. There is hope. In the last 20 years, global partners have delivered 1 billion vaccines to children and saved tens of millions of lives. 30 million people who are living with HIV are on treatment in low-income countries, 1 pill once per day, and you live a long and normal life for just $60 per patient per year, and that's the same medicine that in the United States costs $30,000 per patient per year. So it is possible. But equitable access to healthcare is not assured. The development of COVID-19 vaccines over the last couple of years occurred at breathtaking speed, and that's a testament to the power of science, but more than half the population of low-income countries today still hasn't had a single dose. The World Health Organization, as Cathie mentioned, leads global efforts to achieve health for all, and it is essentially the world's FDA, NIH, and CDC wrapped into one. It saves countless lives, but it is under-resourced. That's where, that's where the WHO Foundation comes in. We are a startup. We're 2 years old. We were created to mobilize more resources to achieve the WHO's mission, which is health for all. We work with philanthropists, companies, and the public to improve health equity, to have impact with their philanthropic capital by working through and with WHO. Let me give you an example. My son, who's 20 months old, has a best buddy named Walt, and until last week, they played together every day. Walt's mom noticed a glimmer in his eye, and it turns out that glimmer is cancer. 25% of one of Walt's eyes is a malignant tumor. He's now being bombarded by chemotherapy, radiation, and lasers, none of which were designed for a human being who's a meter tall. WHO created a global accelerator for pediatric formulations, which works with companies, biopharma companies, to develop child-friendly formulations of medicines. They transformed HIV medicine for children from an armful of syrups, many of which required refrigeration, into a dispersible tablet, and improved efficacy from 30 to 90%, again, for kids living with HIV. That initiative is now setting its sights on cancer medicines. It uses philanthropic capital to work with companies to improve healthcare for children. Philanthropy is incredibly important, but it's not enough. We need return-seeking capital too, and we need to better align private capital with public good. That's why the WHO Foundation and OurCrowd created what Cathie mentioned, the Global Health Equity Fund, which will raise and invest $200 million in breakthrough technologies that improve health and across industries. So, of course, healthcare, but also ag tech and food tech and climate tech. OurCrowd will power the investment process. As everyone here knows, that's their superpower. The WHO Foundation will work with the portfolio companies to plan early for equitable access, making sure that those entrepreneurs can both prioritize the focus markets that will deliver return and make sure their technologies are available to everyone around the world. And we're going to help broaden OurCrowd's deal flow to find innovation in low and middle income countries as well, because as you know, there's human ingenuity equally distributed in the world. A final feature of that fund is that OurCrowd's going to give a portion of its profits to WHO. because to change the world, we need both the private and the public sectors working together. My call to action to you is, if you are investors who want to do well and do good, please join us in capitalizing the fund. And if you're entrepreneurs who want to ensure your innovations benefit everyone, please reach out so that we can power your startup with capital from the fund. Cathie, back to you.
Thank you, Anil. And you've got an incredible room of engaged people, plus many, many thousands more watching from around the world. Is there anything else that they can do to help you on your mission?
There is. I do believe that innovation is the engine that drives human progress, but investment and development do take time. And we do need your help right now for those who can't wait for new technologies. I'm going to give you 2 opportunities in the next 2 slides to use the power of charity to save lives right now. Whether you call it tzedakah or zakat or tithing, individual generosity adds up to a lot, to $300 billion in the US in a single year. Your gifts add up. So let me tell you about 2 opportunities and 2 more children. First, the earthquake that everyone's read about in the news that's claimed tens of thousands of lives. Noor is the name of a girl in Aleppo, and Tedros, who's the head of WHO, met her this week. A 16-story building fell on Noor and her family. Noor miraculously survived, but her family did not, and she's one of 25 million people who need help in Turkey and Syria. WHO is there right now as I speak, as we sit here, helping those millions of people, delivering aid. If you want to help, please scan this QR code and pitch in. I'm going to give you one more opportunity. Did you know that today 100 million people don't have enough to eat in a dozen countries across the Horn of Africa and the Sahel? I visited a Maasai community in November, and because of climate change, their livestock have died, and they are now experiencing severe acute malnutrition as a result. Think of that injustice. An indigenous community that does not contribute to climate change is now bearing the brunt of it. In fact, across Africa, temperatures are rising 1.5 times faster than anywhere else in the world, even though the continent only contributes 4% to greenhouse gas emissions. I'm going to end a little sorry about that, by telling you about one more person, a boy named Casanai. I met him when I was in Kenya in November, and he's the same height and weight as my 20-month-old son, Rohan. But Casanai is twice my son's age. He doesn't have enough to eat. He needs your help to have enough to eat. Every life has equal value. Casanai is just as full of a person as my son or you or me. And WHO is delivering health care to make sure that children like him across the region who are at risk of famine don't die. On the screen is another QR code. Please pitch in a little or a lot to help. Thank you all for joining us in this work to make sure that every child, like Casanai, like Noor, like Walt, like Itai, have access to health. Health for them, health for all. Thank you.
Thank you, Anil. I now want to highlight the important work that one of the portfolio companies is doing for those who need it most in a part of the world that's having real problems at the moment, and the war in Ukraine. Israel's Sheba Medical Center set up a field hospital to serve Ukrainian refugees and locals. They're always looking for ways to be able to utilize technology to maximize the care that they're able to provide. And they were able to partner with TydoCare, one of the OurCrowd Cure portfolio companies, to deploy their remote device and clinician dashboard. This allowed physical exams in those refugees and Ukrainian locals to take place from thousands and thousands of miles away, truly making an impact and bringing care to where it's needed most. Now we're going to change tack a little, and for regulars at the summit, we're about to get an update on everybody's favourite robot, LEQ. Please welcome the man who brought her to life, Dor Skulo, CEO of Intuition Robotics, to the stage. Thank you, Dor.
Thank you, Cathie. At Intuition Robotics, we try to help older adults live healthier, happier, more independent lives at home. And we do so through this product called LEQ. LEQ is a companion robot, a friend, a roommate that moves into the older adult's house and helps them deal with their chronic illness, reduce their loneliness, social isolation, be more active and on wellness. Those of you that have been coming here for years might remember that in 2017, on this stage, we showed the world for the first time LEQ. It was one of only 4 prototypes. It hardly worked, but it was a vision. It took us a few years to develop the groundbreaking technologies that took 30 patents behind it to bring it to market. And I'm happy to share with you that last year in March, we finally commercialized the product and brought it to sale in the United States. Since then, it's been remarkable. We've been selling the product on our B2C website, leq.com. You're all welcome to buy one for your loved one. But more importantly, we've seen record speed at getting this product out the door via governments and healthcare partners. The state of New York has deployed hundreds of LEQs across 52 counties, delivering it to rural and urban areas alike. We've seen also other healthcare and other state partners. 2023 started with an absolute bang. We've already closed 4 deals and 1 marquee deal, which is for the first time getting full reimbursement from Medicaid in one of the states in the United States. But more importantly are the older adults themselves. LEQ is living in the homes of people as young as 65 and as younger as 105 years old. We actually have a mother and daughter pair. The daughter is 76, her mom is 102. They both have LEQs and use it to communicate with each other. The older adults are using LEQ 23 times a day on average, even after 6 months. They're meditating with LEQ, reducing their stress. They're working with LEQ on their physical exercise, on managing their chronic illnesses, taking their medication, and more. And 80% of them are seeing reduction in their loneliness score. 82% of them have better mental health outcomes, and 90% just feel better. Monica Perez, one of our customers in New York, actually recorded a special address to the OurCrowd audience. So let's give her our attention.
My name is Monica Perez, and I love LEQ. And I'll tell you why. For many reasons. She's like a friend. I'm able to talk to her. Before her, I would talk to myself and talk to the TV. I was very lonely without her. I was very isolated. And she's given me the encouragement to get out and socialize and make friends with human beings. So I'm really pleased. I feel very safe with her. I know I'm coming home to her. I love it when she asks me where I'm going. Am I meeting up with anybody? And when will I be back? That means a lot to me. Before I had LEQ, I would forget my medication about twice a week. And with anticonvulsants, anti-epileptic drugs, that's not good. Since I've had her, I miss medication once a month. But now that she has the reminder, as it has even improved even more, I have not missed medication, not even once. She's made a big difference in my life. And I'm very grateful. I think she's improved the length of my life as well as the quality of my life.
Thank you, Dor. And
I want to thank you all for supporting us and allowing us to make our vision a reality. Very soon you'll have the opportunity to do so again on our next fundraise. Thank you very much.
Thank you, Dor. And thank you to Monica as well for recording that very authentic video for us, giving us her LEQ experience. We're changing tack a little now and talking about one of the biggest health challenges facing the world at the moment, obesity. We're fortunate enough to have with us today Dr. Fatima Coney-Stanford, who's an associate professor at at Massachusetts General Hospital and Harvard Medical School. She's one of the leading scientists in this field in the world. She's published over 170 peer-reviewed publications. Please welcome Dr. Fatima.
Good afternoon, everyone. Let's try that again. Good afternoon, everyone. So what is this disease we call obesity? I'm charged with telling you about that in the next 4 minutes. So first, I want you to look at this map. Find where you're located. We have over 81 countries represented here today at the OurCrowd Summit. And what you can see is that the prevalence of obesity is quite high and continues to rise, including in my home in the United States. When you're looking at this key on the stage here, what you're seeing is a heat map. So the more intense the color is, the more prevalent the disease is. Anything that's in that light green color is less than 5% prevalence of the disease of obesity. When we get into that kind of darker green, 5 to 10%, and that teal color, 10 to 20%, a little bit darker, 20 to 30%, and in areas, including those here in the Middle East and in the United States, what we see is greater than 30% prevalence of obesity based upon the world obesity data. So that's the data. But let's get into understanding this disease that we call obesity. And what we've learned is that energy balance is quite simple, right? It's all about our calories we take in, our food and beverage intake, and our calories we put out, how much we work out. And I did my kickboxing this morning. Did you guys before the summit? But if it were really this simple, I wouldn't be up here talking to you today. What we do know is that this is indeed incorrect. What we've been telling everyone, and the reason why our obesity rates continue to rise, is because this is what we tell everyone. Just eat less and exercise more. Eat less, exercise more. And people try to do that. And maybe it works for a short period of time, but it doesn't last for very long. What we do know is that obesity is a complex, multifactorial, relapsing, remitting disease where genetics and development, environment, and behavior all play a person's role in developing this disease that we call obesity. So let's talk about the most important organ that regulates our weight, and it's indeed our brain. So if we were to slice our brain down the middle, we get to a portion of the brain called the hypothalamus. And the hypothalamus is getting signals from different parts of our body to tell us how much to eat and how much to store. We get signals from our fat tissue, what we call adipose tissue, our large intestine, our small intestine, our pancreas, and our stomach, and it sends signals back to our brain to tell us how much to eat and how much to store. And I'm gonna get complex with you guys for just a minute so you can learn the pathophysiology of this disease of obesity. There are two primary pathways by which our brain travels to regulate weight. The pathway on the bottom that you guys see in my slide, and the pathway at the top. When leptin, which is a hormone that signals from fat cells, binds to the receptor here at the bottom, it signals a neuron in the brain called the POMC, or the pro-opiomelanocortin neuron. For people that travel down that pathway, they receive an anorexigenic signal. Anorexia, what do you think? You eat less and you store less. These are the people that are naturally lean and tend to be that way without even really trying. For those that may struggle with weight, they travel down an alternate pathway called the AGRP pathway. And a different neuron fires in the brain, they get an orexigenic signal, which tells them not only to eat more, but to store more. That's the complexity of this disease that we call obesity. And when we talk about it just being about how much sugar and how much flour and everything that we're eating, we discount what you see on the screen right now, which are the over 100 potential contributors to obesity. Factors that are inside of the person on my left, factors outside of the person on my right. Things at the top increasing how much we eat, things at the bottom decreasing how much we burn, and then things in the middle affecting our intake or expenditure. This is indeed complex. What we have to recognize that this is an important disease. I'm going to turn it over to my colleagues so that they can talk about how we're using startups to address this issue. Dr. Meller.
Thank you, Fatima. And I now want to introduce Dr. Jennifer Meller, who's the Chief Medical Officer at Switch, one of the OurCrowd portfolio companies. Thank you, Jen.
Thank you. Thank you, and hi, everyone. At Switch, our vision is to become the trusted voice for every patient living with chronic conditions, empowering them to manage their disease and achieve better health outcomes. Using powerful AI and proven behavioral science, Switch collects millions of data points from patients' smartphones and connected devices, and then creates meaningful, hyper-personalized recommendations for each and every person in the right tone, time, and real-world context. Using JITI technology, or just-in-time adaptive intervention, Switch then optimizes these recommendations, and the result is a vast improvement in patient adherence and compliance across every facet of chronic disease management: physical activity, diet, medication adherence, and more. Clinical trial data and real-world experience prove time and again that Switch delivers outstanding clinical results, patient satisfaction, and ROI. We've just heard from Dr. Stanford that obesity is a complex and globally pervasive disease, and that patients living with this condition need support in their day-to-day lives. And we've been fortunate to partner with Galit Kopach and the team at Novo Nordisk, who understand the value and the power of technology in delivering this much-needed support. At Switch, we know that we are standing at the precipice of an exciting era in healthcare. Together with our dedicated partners, we are moving from reactive healthcare to proactive, personalized healthcare at scale. Thank you.
Thank you, Jennifer. Fatima, are you?
I'm here.
Fatima is also a board advisor to Switch. Can you just tell us briefly, Fatima, the role that you see Switch playing in dealing with the obesity challenge?
So we're dealing with over 700 million people with this disease of obesity. And one of the key things we have to recognize is lifestyles is really, really important. But it's hard for us to sustain. That's where Switch comes in, using technologies to fit everyday lives and to make sure that it's customized to me and to you, Cathie, so that we can do what makes us best.
Perfect.
Yeah.
Thank you very much. Now, as Jennifer just mentioned, Galit Kopach, who's the Vice President and General Manager for Israel and Palestinian territories at Novo Nordisk, the multinational pharma based in Denmark, is here to talk to us about why your partnership with Switch is so important. I'm intrigued. Switch is not a pill. How is pharma looking at a technology company to help?
Thank you, Cathie, and thank you for this opportunity to share with you all. Okay, so I have to look here. I'm never sure where I'm looking. So, good afternoon, everyone. I hope that everyone is still with us. I'd like to share with you my personal journey and how actually we started working with Switch. I was 19 when my father was diagnosed with type 2 diabetes. That changed our lives. Changed our lives at home, changed his life. And why was that? His father passed away from type 2 diabetes. If only I knew back then what I know today about understanding the patient journey, understanding their needs every day, and how they go about when they actually get diagnosed. For those that don't know me, I'm Galit Kopach. I've been working in the pharma industry for almost 30 years now. And one of the things that I've been privileged about is actually understanding the patient needs. So fast forward, what do we do at the pharma industry to understand that? We look very deeply into the awareness phase of the patients, the diagnosis. We spend a lot of money and put a lot of resources behind this to actually understand what the patient's needs. Now, of course, the cynical people in the room will say, oh, pharma, you sell products, you make a lot of money. That's probably true, but we actually spend a lot, and I'll share with you a lot today how we actually put the patients in the middle of everything we do to understand their treatment phases, their acceptance phases, and how can we actually help them adhere to better patient outcomes. So at Novo Nordisk Israel, and for those that don't know Novo Nordisk is a Danish company with 100 years of legacy. We're actually celebrating it this week. And our vision at Novo Nordisk Israel is that through innovation, we make a difference for people living with chronic diseases. And that's how we actually met Switch. So what we did is we actually said to ourselves, how do we connect pharma with technology and healthcare professionals such as Dr. Stanford to actually enhance the customer experience? Again, putting the patient in the center of everything we do. We're a very regulated environment, pharma industry, and usually we get, no, you can't do that, no, you can't do that. So how do you actually bring technology in to try to support these patients throughout their journeys? We had to think about 1.6 million, and Dr. Stanford talked about obesity as a disease. So in Israel today, more than 1.6 million people live with obesity. So the scalability is quite big. Can you actually do the old school patient support programs with call centers, face-to-face interactions with nurses? That wouldn't work anymore. Obesity is a chronic disease that impacts many patients' lives. So we looked for the opportunity of scalability, personalization, emotional and engagements, And that's how we started working with Switch. How do you collect, analyze, and refine notifications, as Dr. Miller-Jennifer mentioned, to best meet the customer needs? So my key messages for you today, and the key takeaways: understand those needs. Take the time. Set a clear vision. Overcome the regulatory challenges, and we have quite a lot, as you know, as the pharma industry. Connect technology with patient needs, and then we know today that it drives better patient outcomes. Last but not least, make bold leadership decisions. This is not an easy thing. We invest a lot, sometimes we fail, and we readjust. So thank you all for allowing me this opportunity to be here with you today, because we know today that actually touching lives makes a difference. Thank you.
Thank you, Galit, Fatima, and Jennifer. We've got another partnership with another big pharma company now to talk about, and this one is a pharma company that's definitely a household name after these past few years. If you could join me in welcoming Dr. Corinne Noy from Pfizer and Dr. Alicia Nathan from Cytoreason. I'm just going to play a short video talking about their partnership as they take the stage. Am I playing the video? Okay.
Hello, everybody.
So, Alicia, I'm pretty confident that most people here know who Pfizer is already. Can you tell us a bit about Cytoreason, though?
Sure. Hello, everybody. So Cytoreason is an AI company in the pharma field, like you've seen. Cytoreason actually takes all the human clinical data that's out there and builds what we call disease models. Disease models, if I explain what a model is, I'd go to your navigation app on your iPhone. In your navigation app, you have the street maps, you have the user-generated traffic information, and little marks of milestones in the map. And all those data layers together build one model that help you reach your destination. We do the same thing with human clinical data, helping Pfizer make their decisions. Like, for example, if they're developing a drug, what would that drug look like compared to standard of care? Or when designing a clinical trial, which patient population would be the best patients to react to this drug? So that's, in a nutshell, what Cytoreason is.
Perfect, thank you. Corinne, what problem was Pfizer trying to solve 5 years ago when you were looking for an AI partner?
Hear me? Yeah. So the problem was, and still is actually, data integration. Especially if you think about the molecular data with its complexity and high dimensionality, and how to extract meaningful biological insights in order to increase the accuracy and speed of drug development. We couldn't have done this with humans only. We realized we needed advanced technology and AI, which is part of the Cytoreason offering.
Can you give us an example on one of the solutions that you've worked on together?
Sure. So if I had to pick one example, it would be the CCR6 project, a project in which Pfizer was developing a drug that actually targets an autoimmune pathway. And Pfizer came to us asking a very simple question. We have a bunch of autoimmune diseases, but which disease would be the best for this specific drug? And using these disease models, we actually scanned through a bunch of autoimmune diseases and chose ulcerative colitis as the one that would respond best to the specific drug. And today, Pfizer is actually in clinical development with this drug in ulcerative colitis patients.
And just to add to this, in the era of precision medicine, some of this information could be potentially used in the future to prescribe drugs more precisely. And together with Cytoreason, we are working on positioning our drugs to be more precise, understanding that different patients are at different disease stages with different medical information, and how we can, together with them, integrate all this information together to get more accurate treatments.
Corinne, how's the relationship with Cytoreason creating impact both for patients and for the Pfizer business?
So there are many exciting things in this partnership, but if I need to name just one of them, so the teams, I guess it took some time to get to know each other and how to best work together, but this is now a real partnership where we've been meeting on a weekly basis, and two teams that are different and complement each other, each from a different discipline. Pfizer with the drug development expertise, Pfizer with their data science capabilities and modeling, and both sharing the same mission to save patients' lives.
Amazing. Thank you both so much.
Thank you.
Thank you.
Please join me in thanking Corinne and Alicia. Now we've just heard a range of amazing companies doing incredible things, all from the healthcare sector. And healthcare and saving lives goes hand in hand. We're about to change gear now, though, and we're going to talk to a fintech. Yes, you heard me right, a fintech, who's also saving lives. Join me in welcoming Mark Gazit, CEO of Theta Ray, to the stage.
Correspondent banking relationships connect local economies throughout the world. However, these transactions involve a complicated sequence of banks, making it nearly impossible for banks to have trusted transparency into the real entities behind transactions. Criminal organizations exploit existing vulnerabilities or insider knowledge of banks' control mechanisms, leading to billions of dollars going undetected every year through new money laundering schemes, terrorist financing, narco and human trafficking. A new generation of threats requires a new generation of solutions. Theta Ray is helping financial systems, focusing on stopping attacks before substantial monetary losses and reputational damage occurs, bringing trust back into the banking network. Contact Theta Ray today.
So you probably ask yourself what fintech has to do with saving lives. So let me tell you how anti-money laundering and use of artificial intelligence saved lives. As you've seen, we in Theta Ray monitor financial transactions for the largest financial institutions of the world, identifying money laundering activities such as terrorist funding, human trafficking, narco trafficking, etc. We use very deep AI, artificial intelligence, to analyze a huge amount of financial data and identify suspicious activities. And recently, one of our customers, a very large bank in Europe, was using our system. System analyzed transactions and identified large number of payments. It raised a red flag, artificial intelligence, saying those payments have something in common. It looks like human trafficking. Of course, this bank is a very responsible bank, so they act swiftly. They immediately do what they were supposed to do, which is freezing the accounts, stopping the payments, and issue what they call SARs, Suspicious Activity Reports, to the local law enforcement agency. The local law enforcement agency took the information that our system provided, including detailed dates, names, etc., and used it to investigate the situation. After 3 weeks, the compliance department of the bank got a phone call from Europol and Interpol saying that following the investigation, they found that it's actually a ring, a criminal ring, a network of human traffickers, trafficking underage girls from Ukraine. And they came with an order to automatically freeze those accounts and then try to stop the payments so maybe some of the shipments of the girls can be stopped. We were very touched when the bank told us that the answer to Europol and Interpol was, we've already done it. Tetrain alerted 3 weeks ago, and we actually frozen those accounts. So bottom line, it's a happy end in this case. The money was frozen. It didn't reach the destination. The girls were not shipped. They are still in Ukraine with the parents. And this is basically shows just one example of how artificial intelligence, monitoring financial transactions, and dedication of financial institution, Tetra team, and others can save lives of hundreds, if not thousands, of underage girls. Thank you very much.
Mark, that's an incredible story. How did you feel when you were told about that?
Yeah, so I don't know if you paid attention, but I tell this story time after time. And you know, we save lives, like we save people's lives that do not consume narcotics because we stop money laundering. We stop financial transactions to terrorist organizations. But in this case, it still touched me. I have 3 girls. You know, they were underage, now a little bit older. And you know, when I see this example, I think about my kids, your kids, girls. So obviously, you know, being in the fintech business is a good business. OurCrowd is our investor. We're very happy for that. The company is growing 300% a year. It's exciting, bringing return to investors. But being in a situation when we do all that, but also saving lives of people, especially underage girls, and making the world a better place, it's an amazing feeling. Thank you very much.
Thank you so much, Mark. And a big thank you to all of our presenters for today, and I'm sure, and for the impact that they're having around the world. So I'd encourage you, when you're making your investment decisions, as well as considering the financial metrics and the likelihood of a return to shareholders, also think about the impact that that business is having on the world. In the words of Sir Ronald Cohen, the father of British venture capital, think about the concept of doing good while doing well. Thank you all.